Come in.
Hi, how are you?
I'm good. How are you?
I'm pretty good. My name is Mohammed. I'm your student nurse for today, and I will be performing a head-to-toe assessment on you. I'm washing my hands here real quick. Um, and first things first, I need to see your wristband. And can you give me your name, your date of birth, and the date today?
Joshua LaFave, 10/4/95, on April 8th, 2015.
Okay, and Josh, do you have any pain?
I do not.
Do you have any allergies?
Nope.
Okay, patient seems to be in a pleasant mood. Patient's hygiene is very good. There are no odors. Patient appears to be the stated age, and there are no clear signs of illnesses. Okay, Josh, I'm going to be starting off with your hair.
Okay.
And I'll be looking for lesions. And there are no lesions, and your hair seems extremely healthy.
Okay.
And I will be palpating your face.
Okay.
And the patient's color seems appropriate to his ethnicity, and the patient's skin is also warm. So next, I'm going to be checking your eyes, and your eyes are symmetrical.
Okay.
And I'm going to test how reactive they are. So can you look over to the shoulder? Okay, now look over the shoulder. Okay, now can you follow the pen? Okay, patient's eyes are perla, and also can I check your conjunctiva? Okay, they are pink and moist. And then I'm gonna go down to your mouth. Can you open up for me? The buccal mucosa is pink and intact. The gums are healthy, no receding. Teeth are white. Tongue is red. And can you take your tongue out and say ah? Okay. The uvula reacted and is midline. And okay. Can you close your mouth for me? And now I am going to check your cranial nerve. So can you close your eyes?
Yes.
Where am I touching?
Forehead, chin, nose.
Okay, so cranial nerve 5 is intact. Now can you open up for me? Can you frown? Can you smile? Puff your cheeks? Okay, and cranial nerve 7 is also intact. So now I'm going to go down to your neck, and I'm going to check your carotid arteries.
Okay.
So can you take a deep breath? Hold it. Okay. Take a deep breath again. Hold it. Okay, his carotid arteries are +2 and bilaterally. And now I'm going to check for bruits. So can you take a deep breath? Okay. Okay. There are no bruits present in the patient's carotid arteries. Now I'm going to check your upper extremities, which are your arms, and I'm going to be palpating them, feeling for lesions, any abnormalities, and there are none. Your skin is very warm, intact, and I'm going to check for your brachial artery. Plus, they're both bilaterally. Now I'm going to check for your radial pulses. +2 bilaterally. And now I'm going to check your nails. Nails are very healthy. And I'm going to check your capillary refill. Less than 3 seconds, but I'm going to do them for all of them, just to make sure. Okay. Now can you grip my hand? Okay. Patient's grip is very strong. 5 bilaterally. Okay, so now I'm going to go and check your heart sounds. And I am going to start on your right side. And that is your aortic, which is in the second intercostal space. And this is your pulmonic, which is your second intercostal space on the left. Herbs, which is the third intercostal space on the left. The tricuspid, which is the fourth intercostal space on the left. And the mitral, which is the fifth intercostal space on the left side. And I will be listening for 1 minute for your mitral. Okay, now I'm gonna go back with my belt to check for murmurs. Okay, patient's heart seems healthy, no murmurs, and his heart sounds are appropriate. Now I'm going to check for your lung sounds. So, if you could just take breaths for me as I'm doing it. Thank you. Okay. Now I'm going to be checking them bilaterally on your side. So if you could do your hands like that for me, please. Okay. Now if you could please stand up and turn around. I'll be checking the back side. Okay. Patient's lung sounds are clear. There are no wheezing, and they are appropriate. Now, if you could, I'm going to be checking your spine alignment. So if you could bend over and touch your toes. Okay. Patient's spine seems to be aligned according to his body. And now I'm going to do your CBA. Is there any tenderness?
No.
Any tenderness?
No.
Okay. Now I'm going to have you walk to the door and come back over here. Okay, patient's gait is normal, and I'm going to have you put your hands to your sides, your feet together, eyes closed. Okay, patient passed the Rumberg test. He can balance himself just fine. Okay, now can I have you lay down on the bed, please?
Yes.
Okay. I'm going to be checking for the patient's contour, and his contour is not flat actually. His chest is kind of concave, and I'm going to be looking at his chest to see if there are any scars or any of the sort, and I'm going to auscultate your bowel sounds, and if you could just breathe normally during that. You have bowel sounds active in all of your quadrants, and I'm going to name you the organs in each quadrant just for your information. In your right upper quadrant, you have your liver, you have your kidney, you have the head of the pancreas, and you have part of the ascending colon. And in your left upper quadrant, you have the tail of the pancreas, you have your spleen, and you have your kidney. And in your left lower quadrant, you have your descending colon and your sigmoid colon and your left spermatic cord. And in your right lower quadrant, you have your appendix, the ascending colon part of it, small intestine, and your right spermatic cord. Okay, so now I'm going to percuss.
Okay.
And tell me if you feel any discomfort. Okay. The patient's abdomen is tympanic, other than the liver, which was a little bit dull, and that is normal. And now I'm going to palpate, and tell me if you feel any discomfort. Okay. Patient's abdomen is normal. Uh, there wasn't anything abnormal about it while I was palpating or percussing. Okay. Now, if I can have you sit back up. Yes. Yep. And now I'm going to check your lower extremities. And I'm going to palpate. I know you're wearing pants. And patient's skin is normal and warm. Skin color is appropriate for his ethnicity. Now I'm going to check for your pulses. +1 bilaterally. Okay. Now if I could have you take your socks off for me, please. Okay. And I'm going to check your pulse behind your ankles. +2. And your pulse in your feet. +2. And I'm going to be checking for edema. So their edema is negative. There is no pitting. And the feet are normal. And one thing I forgot to mention was the face drooping. You don't have any face drooping. Your face is quite symmetrical. And can I see your nails again? And also, there does not seem to be any clubbing in your nails. And that will conclude our head to toe assessment.